This is our orientation introduction for NRSE 5405 for spring 2013. This is for the four of you who are doctoral nursing students. This is your first psych baseline class with 5404 with Dr. Lee Powers, and this companion course for the clinical experience is threaded very carefully with Dr. Powers' course and Dr. Rice's course, which is the psychopharmacology course. We've worked very hard to integrate these carefully for you. I'm looking forward to working with you with your clinical experience. I appreciated the emails you sent back to me in response to my questions, and I will look forward to meeting with you online, both synchronously and asynchronously as we work that through. I will also be emailing you this evening to send you your syllabus and a draft of our course calendar. The syllabus will not change, but the course calendar we may adjust as we go through the semester. You will be implementing the content that you learn in 5404. Most of that content is your basic psych content that you will be working on with assessment, diagnoses, and treatment for the rest of your professional life as psych nurse practitioners. So the emphasis on these first courses will be on spending time learning how to do very professional, accurate, full initial psychiatric evaluations, and then moving your thinking forward to how do you formulate diagnoses, how do you consider differential diagnoses, how do you work with your preceptor to understand more fully what your thinking needs to be, how do you work with your faculty to sort out your new thinking about differential diagnoses and appropriate treatments. Since 88% of current psychiatric diagnoses do not have an indicated medication treatment, I'm going to repeat that again. Since 88% of current psychiatric diagnoses do not have an indicated medication treatment, it will be important that we think through all of the resources we can bring to bear for our patients who have mental health difficulties. It is always fine not to prescribe a medication. We'll talk about crisis and safety needs. We'll talk about ethical considerations, and we will also evaluate what are some of the algorithms and treatment guidelines that are available. I will remind you that the DSM-5 is due to come out in May 2013. That's the Diagnostic and Statistical Manual for Psychiatric and Mental Health Disorders. The last publication was the DSM-4-TR, which came out in 2000. That text is the one you will be using for this semester. Interestingly, I went on the website for the DSM-5 for the American Psychiatric Association, and they have taken all of the proposed changes off the website. I think that is both amusing and understandable because everybody's intensity will ramp up over the next few months as insurance companies, as providers, as pharmaceutical companies try to understand what the changes in the diagnoses will be. We will discuss those as well as we can, but we will at this point use what everybody else is using, which is the standard DSM-4-TR diagnoses. That is covered in each of the modules on the website for 5404. Those are put in order with your Kaplan and Sadek text and with the DSM-4 itself. I will not address many of the psychopharm treatments in the 5404 content. Dr. Powers and Dr. Rice will be doing that together in their two courses. The work you and I will be doing together will be on implementation and discussion together. I will look forward to communicating with you soon. I apologize, I will be missing your intensive experience the week of January 14th. I know you'll be meeting with Dr. Powers and Dr. Rice on January 16th. I will be back online with you the week of January 21st. I will look forward to communicating with you then. Do not be distressed if there are any questions in the interim. I'll be glad to get those back to you as soon as possible. After my return from this meeting, I will be able to be in touch with you at least every 48 hours in response to your emails, and I will make sure you have my contact information so we can talk to each other by phone or by Skype or by discussion board. I look forward to working with you. Thank you.